Alrighty, we're live now with the radiation therapy program, and here's Alfred. He's a faculty of the program.
Hi guys, welcome to the radiation therapy department. If you look over to your left, as you can see, we're doing a bunch of tours of the various programs. This is the radiation therapy program. The place where you're in here with all these screens, this is the elective suite. So this is where we deliver the radiation. Actually teach our students how to deliver the radiation. So actually, if you follow me, this machine is called a linear accelerator. This is what's used to treat cancer patients. And at our school, we work on phantoms, and this linear accelerator can go up and down, in and out of the machine. This function right here, this is called the gantry, and the gantry rotates back and forth. About what radiation therapy is, basically it's the use of ionizing radiation to treat cancer patients. So if a patient had, let's say, prostate cancer, our job would basically be setting them up into exactly where they need to be. So for example, I can turn off the lights and I can line up the lasers. There's actually, it might be a little hard to see. And once we get them in the right position, we can basically treat the target by the gantry rotating in multiple directions. So it's pretty cool. It's a very targeted treatment. So this area is where we deliver the treatment, but there's other areas where we actually plan the treatment, where before this patient got here, they actually got a CT simulation where we basically took CT scans of exactly where their prostate, let's say we're treating the prostate cancer. And then after, we would actually make a plan so that we're treating the prostate with the dose that we want them to have, while the normal tissue does not get dosed, like the rectum and also the bladder. So that's pretty much one of our environments. Do you have any questions about the program?
Well, what would you say the foundational education you need to get into the program? What would you most recommend people to have been studying prior?
Okay, most of our students actually have, with the medical radiation science program, it is not a direct entry from high school. You need a minimum of 1 year university. Most of our students actually have a degree already. Most of them have studied in life sciences, biology, physics, chemistry. There are some prerequisites for our program, which you can check our review book. The courses that you'll be taking in our program will be both technically based, such as physics, radiation biology, and also soft skills, such as patient care. So the profession of radiation therapy it's very interesting. Not only do you have to operate these machines like linear accelerators, you have to understand how they work, the physics behind it. At the same time, we have to realize that there's actually a patient on the bed, a real person that's experiencing cancer in their journey, and you have to be able to have those soft skills to be able to educate them about their side effects. The thing about radiation therapy is that not only do they come in one day and then we treat them, they come in many days. So you actually, on a span of 7 weeks, you'll see them every single day, so that you actually form relationships with them, and basically you educate them, you make referrals where necessary. So it's pretty cool. It's a very rewarding profession, and you learn a lot. And I'm really proud to be a radiation therapist, because if you think about it, there's a lot of doctors, there's a lot of lawyers, there's a lot of different professions, but there's not a lot of people that can call themselves radiation therapists.
Awesome.
Yeah.
Well, while we walk, where would be the next?
We're going to go to the treatment planning area.
Great. So, Alfred,
Yeah.
what would you say are the graduates, once you graduate from the program,
Let's go this way.
where would you most likely be working, and what are some opportunities?
Once you graduate from the program, most likely you'll be working at a cancer center. A cancer center basically has a role as a radiation therapist treating cancer patients. Within the cancer center, there's many different areas that you can go. There's CT simulation. That's basically where you're planning the treatment. There's treatment floor, which is basically delivering radiation therapy treatments. You could also be working in dosimetry, which is where we're going to go next, because remember I told you that when we do take the CT scan, we actually make a treatment plan that's customized for that one patient. So you could be a dosimetrist. Some students go on to become medical physicists. There's a lot of room for research, because we know that with the modern age of technology, that we're finding a lot more targeted ways to use radiation to treat cancer patients, so that, because back in the day when we used radiation, a lot of our patients had a lot of negative side effects, and we found that with a lot more research, we're able to use the machinery to actually have more advanced technology so that patients have less side effects, because ultimately the goal is we want to make sure it's patient-centered care. So yeah, we're just going to approach the next room in a little bit.
Hey guys, we're just coming in with the Facebook Live.
So we're going to send an invitation to you guys.
This is a lot of the people from ultrasound, so
Okay.
let's go in. Let's go in.
Next term.
This is another.
Oh, yeah. Awesome.
Hello, everybody.
This is Renata and Rahul. Do you guys want to talk about the symmetry?
Hi, guys.
I
She's on the camera. Okay, so my name is Rahul. I'm an associate professor in radiation therapy here at Meister. There's a big backstory before a given patient comes to treatment planning. Speaking just from the treatment planning part of it, if I was in clinic, what I would see is my colleagues, my CT staff, the therapists that are working there would send me a CT scan. And on that CT scan, I would go ahead and complete my treatment planning. So here's an example of a CT scan that's sent to us. In this particular case, we are treating the right breast of this particular patient. So the doctor has given us orders. The doctor's told us that this particular patient needs to get treated to the right breast. For what type of dose, the doctor will let us know, and we will go ahead and plan this patient. So in this particular case, you could see the way the software works. We can use the software to our advantage. The software is directly connected to our treatment units, which you may or may not have seen already, the Elekta units that are over there. So on the software, we can manipulate the beam. So we could say that for this particular patient, we want to treat the right breast. So we want the gantry to treat from this particular angle, and we also want the gantry to treat from this particular angle. Because this patient is being treated to the breast, there might be some modifications, some devices that we need to use to be able to treat this patient. So in this particular case, we need wedges to be added. Again, in software we're adding it so we can model it within our software, how we're going to be treating it, so that it is a accurate representation of when we send it off to the treatment unit, how the particular patient is going to be treated. So now we'll go ahead, we'll say that yes, our plan is great. We have not only assessed that the breast is getting treated to the dose that the doctor requires, but also at the same time we're avoiding the dose that we don't want to treat our lung to. We don't want to treat our heart, we don't want to treat our spinal cord. So we take that all into account. Once we're happy with that, this will be sent off to the treatment unit, and we'll go ahead and treat that particular patient.
Amazing. So in terms of program delivery, so for your students, what's different or what is special about your delivery, and how do you teach these things?
Well, okay, so it's the fact that we could simulate what's going to happen at clinic. So this is actually exactly what a therapist would be doing in clinic. Now, when they graduate from our program, typically they'll be introduced to frontline staff work, treatment unit work, and potentially CT simulation work. But knowing these two things, in keeping these two things in mind, what you can then transfer this knowledge into is how does it apply to our software. So coming to this course into physics, what we could then do is we could get our students to actually plan out, and we will assess them. We'll figure out, we'll challenge our students, and we'll come together, making sure that our students know that this is how is real time expected of them when they go into their clinics.
Awesome.
Yeah.
Anything else to add, anyone? So these are some current students.
Current students right now, yeah.
We've been asking this all day. It's kind of a regularly asked question, but do you maintain a part-time job while in the program?
Yeah.
Yeah,
Yeah?
yeah. I work a couple times a week, and it's not too bad. It's pretty easy to balance.
It's doable.
It's doable?
I worked last year. With commute, it got a little bit too much, but it's completely possible to do it.
And have you guys had any clinical experience in, I'm not sure what level?
Yeah, so
Yeah.
we're second year, so we've done 2 months in the hospital already. So it's been really beneficial, I'd say, for our learning. We've learned a lot.
You'd say Michener is preparing you for those?
Oh, yeah.
Definitely.
Yes.
Yeah.
you're enjoying your program?
Yes, we love it.
Yeah.
If anything, where were you before your time with the radiation therapy program?
I was at Waterloo. I did a BSc there.
I did 2 years at Laurier.
I have my degree from, well, in biosci.
Okay, well, should we move on to the simulation room, or?
Nope, those are the two environments I wanted to
Okay,
show you
great.
guys. Yeah.
Anything else to add, Al?
I just want to say that radiation therapy is a very rewarding profession, and if you choose to come to Michener in the radiation therapy program, you'll be very proud to be part of the Michener family. And yeah, thank you for coming to our tour.
Okay, so now we'll be pausing again, but we'll be returning shortly with more programs.